For this video, I'm going to be demonstrating how to mix and administer some insulin. First thing I'm going to do is verify the physician's order, identify my patient, and identify myself to the patient. I'm going to come in, wash my hands, don some clean gloves. For demonstration purposes, I'm not going to be putting on the gloves. I'm going to perform a focus assessment on the patient. I'm going to verify that they have had a glucose check, that the results are in the chart. I'm going to examine for any signs of hyper or hypoglycemia. I'm going to ask where their last injection site was or verify that it was charted in the chart. Assess the skin, and I'm going to verify that the order for the insulin is on the MAR. Next thing I'm going to do is I'm going to compare my insulins to the MAR and make sure that their orders match. I'm going to check the expiration date on the vials, and I'm going to check that the date that they were opened is still within range. I have my regular insulin and my MPH insulin. I'm going to roll my vials to make sure to mix in that insulin if anything is settled to the bottom. Make sure to roll both vials. Disinfect the tops of both vials. I'm going to get my insulin syringe. My order says that I'm going to withdraw 16 units of NPH and 6 units of regular insulin. So I'm going to get 16 units of air. 16 units. Not sure if you can see that. I'm going to inject that into my MPH. Withdraw my needle. And then I'm going to pull up 6 units of air. 6 units. Inject that into my regular insulin. And then I can draw up 6 units of regular insulin. This is a 100 cc or 100 unit insulin needle. In a real life scenario, I'd be using a 50 unit because it's more accurate when using small doses like that. So I've got my 6 units of regular insulin. Can't really see, it's kind of blurry. And then I'm going to draw up my 16 units of NPH, making sure to just withdraw. Don't want to mix that into the vial. So then I'm going to have 22 units total, 16 of NPH, 6 of regular. I'm going to recap my needle. Place it back into the sleeve. I'm going to label it if I'm outside the patient's room, how many units, the patient's name, room number, date of birth even, just to verify that everything's correct. Beforehand, I'm going to verify this with a second nurse. 2 nurses have to verify insulin before administration. Once I go into the room, I'm going to perform a 3rd check at the bedside. I'm going to explain the procedure to the patient, explain their blood glucose score and why they're getting the insulin. I'm going to explain the sites that they could receive the insulin. We can do the abdomen, the lower abdomen and that belly fat. Can do the back of the arm over here in the triceps. Can even do like in the back area, any fatty area of tissue. Most people like to get theirs in their tummy, so I'm gonna pretend like this is my patient's stomach right here. I'm gonna clean that off with alcohol swab. If I can pinch up 1 inch, I'm gonna do a 45-degree angle. If I can do 2 inches, I'm gonna do a 90-degree angle. So I'm gonna pretend this is just 1 inch, and I'm gonna do a 45-degree angle. Insert, inject my insulin, retract. I'm gonna put my needle into a sharps container, apply some pressure to the site with an alcohol swab. I'm gonna safely dispose of that needle, wash my hands, take off my gloves, document that, any unexpected results, and the amount of insulin I gave in the chart.